And here is our friend, the food pyramid. We've seen this many, many times. And it goes over all the nutritional requirements that we're all very familiar with all the categories. Cultural foods affect food preferences and habits. We have to take that into consideration too. Simple nutritional questionnaire used in pregnancy management of pregnant women. And it covers all the bases there. And that's 18.5 in your textbook. Dietary reference intakes for non-pregnant females and for pregnant and lactating females. It goes into all the nutritional amounts. Recommended weight gain ranges for pregnant women, and it goes from low to normal to high to obese. And that table's on 18.2. Nutritional requirements. Carbohydrates need to be adequate or the body will use protein for energy. When protein is not available for growth, they break down, which leads to ketosis. Protein are needed for amino acids to the fetus, blood volume expansion, and growth of maternal tissues such as breast and uterus. Need 60 grams per day. Unchanged, the fat is unchanged during pregnancy and should amount to 30% of the total caloric intake per day. Minerals needed for growth. Calcium and phosphorus needed for mineralization of fetal bones and teeth. If inadequate intake, the fetus takes from the mother. We had talked before about how a baby is like a little leech inside. If you don't give it to the baby and take extra for the baby will take it away from you. Iodine must be met for brain development. Inadequate intake can result in cretinism. What is cretinism? If sodium is restricted, may take supplement 220 micrograms per day. Sodium required for metabolism and fluid balance, 2 to 3 grams per day. Avoid high salty foods and adding additional salt at the table, especially towards the end of your pregnancy. Nutritional requirements continued. Zinc needed for protein metabolism and synthesis of DNA and RNA, essential for fetal growth and lactation, 11 milligrams per day. Magnesium, it's needed for cellular metabolism and structural growth, 120 milligrams. Iron, needed for extra blood volume, usually given in a supplement as diet intake, is 18 milligrams. Pregnancy needs are 27 milligrams per day. Vitamins, fat-soluble, A, D, E, and K. A, grows epithelial cells, the GI tract and skin, and plays a role in metabolism and carbohydrates and fats. D is needed in its role in absorption of calcium and phosphorus for skeletal development. E, antioxidant, prevents other nutrients from undergoing chemical changes. K is used in normal blood clotting. Nutritional requirements. Water-soluble vitamins are C, B, and folic acid. C aids in formation and development of connective tissue and vascular system. The B vitamins, B1, B2, B8, and B12 serve as coenzyme factors in many reactions such as respiration, glucose oxidation, and energy metabolism. Folic acid is needed for normal growth and reproduction, lactation, and prevention of neurotube defects. Fluid, 8 to 10 8-ounce glasses a day. Most beverages should be water and avoid caffeine. Vegetarianism. The American Dietetic Association states that nutritional needs can be met on this vegetarian diet. Daily food plan for pregnant and lactation. It goes over, it's a pretty good list there on 18.3. Amount of protein, what you get out of your dairy products and all your other foods. common foods. Foods that provide comparable amounts of calcium. It's a good list there. And vegetarian food groups. Factors influencing nutrition: age, dietary practices, lifestyle and culture. Common discomforts of pregnancy: nausea, vomiting, heartburn, and constipation. Use of artificial sweeteners. Aspartame is safe when used per FDA guidelines. Splenda and sucralose. Anomalies that may indicate an undisclosed eating disorder. Abnormalities. Somatic and behavioral. And they're on table 18.7. Other dietary considerations. Mercury in fish. Do not eat swordfish, mackerel, tilefish, or shark. You can eat shrimp, salmon, catfish, and pollock. Light tuna in the can is lower than white albacore. Can eat 6 ounces a week. Salmonella and Listeria infections. Avoid raw eggs and anything containing them. Avoid ready-to-eat refrigerated foods, unpasteurized milk, dairy foods, lactase deficiency, lactose intolerance. May be managed during pregnancy with over-the-counter enzymes. Cultural, ethnic, and religious influence. Affected by region, the foods of the local areas. Ritual foods. Need to be aware of the culture and religious choice of diets and counsel accordingly. Psychological factors. Feeling about the pregnancy may present as loss of appetite or gaining weight. Eating disorders may continue during pregnancy only to resume, may discontinue during pregnancy only to resume postpartum. Look at table 18.7. They present special problems due to the secret nature of this disorder. Pica. What is a pica? What is pica? Iron deficiency anemia is the most common problem of pica eaters. Pregnant adolescents, they're emotionally charged, and weight gain can be an issue. So we see a lot of them starving themselves or denying that they're pregnant, and they don't want to get fat and they don't want to gain weight, so they don't eat right. Other dietary considerations. Let me see. Adolescent, considered psychologically mature or physiologically mature. Younger need to meet adult weight gain during pregnancy. Nutrients widely vary in diet and age. Counseling issues. Be positive. Tell adolescent it is not only her health, but that of the baby. Postpartum nutrition. Formula feeding moms. Time to take care of herself as to weight gain and learn about nutritional needs of infant. Breastfeeding moms. Increase 200 calories per day over pregnancy needs. Protein increases to 65 grams per day. 6 months after, it's 62 grams. Calcium, 1,000 milligrams per day. Iron, not different, but continued supplements for 2 or 3 months to restore mother's iron depletions. Fluids, 8 to 10 8-ounce glasses of water, juice, or soup. Counseling as to what to eat or not to eat that will affect the baby, such as beans, cabbage, they can cause gas, and caffeine and chocolate, and drinking alcohol. Counsel concerning medications. Mom will need to share with her physician treating her that she is a breastfeeding mom. It may change the medication that will be offered. Review nursing care plans in their text. They had some excellent care plans in your text.